Hello, dear YouTubers from all around the world. I would like to talk to you today about Generalized Anxiety Disorder, which is a psychological and psychiatric condition that affects hundreds of millions of people around the world. And it's actually something that it's very treatable. We can treat, we can improve this condition by doing some simple things in our everyday lives. But first of all, it's very important to understand what Generalized Anxiety Disorder is. So, as I said, it's a psychiatric condition which is characterized by the presence of an excessive worrying about many different various things in our everyday lives. So, people who suffer from generalized anxiety disorder should, for at least 6 months or more, be practically constantly worrying about different issues in professional terms, in terms of health, family, work, money, with a difficulty to control their worry and with a significant distress in their everyday lives, which means that this constant worrying, this constant anxiety about different issues in all spheres of everyday life should be really impacting negatively their functioning in terms of social, interpersonal relationships, professional relationships, etc. So they should have, as a result of this problem, a very important distress personally or the people around them, the people that surround them. It is important to say here that some people with relatively mild anxiety levels who have a subclinical anxiety disorder, or maybe an anxiety disorder but which is not as clinically significant and severe as in some other cases, they may actually be capable of functioning socially and have meaningful and full lives, maybe needing a little bit of help like doing meditation or maybe trying psychotherapy or maybe changing their lifestyle. We're gonna talk about all of these aspects later in this video. But people who suffer from an anxiety disorder like generalized anxiety disorder to an important degree, they may actually need medication as well. So, generalized anxiety disorder is a relatively common psychiatric disorder in the sense that it actually affects approximately 2.5 to 3% of the population, especially younger people, young adults. And this is the case mainly for women, because according to studies, women are twice as likely than men to be affected by this disorder. It's a disorder that may last for many years in the life of a person, and the exact cause of this disorder is quite complicated to define, but according to many studies so far, we know that there are biological and neurological factors. There are genes that are associated with a vulnerability to developing generalized anxiety disorder, but there are also other psychological and social factors, life experiences, traumatic experience, especially during the first years of our lives, especially when it comes to attachment quality, to the quality of the attachment and of the relationship that was developed between the baby and its mother. And other stressful experiences during our lives, especially during our first years of life, like a family divorce or like a painful experience like the death of a loved one, especially during our first childhood and adolescence. We know that people who suffer from this disease, actually they do not know how to stop worrying, the worry cycle. It actually feels as if it's beyond their control. There are many people who believe also that worrying is a good thing. It can actually make them more functional. It can prevent bad things from happening. So they think it's actually bad, it's actually dangerous for them to give up worrying. People who may suffer from this condition may also suffer from physical symptoms, and these symptoms may give space to many assumptions that they may actually suffer from physical conditions. These people may have stomach aches, they may have headaches, they may have other uncomfortable physical sensations, and they may start believing that they suffer from another serious medical condition. So there is also a difficulty tolerating uncertainty, and so it's very difficult for these people to plan situations, to control what they're going to do in a next given situation. So there is an anticipatory anxiety before something, an important event like a presentation in the workplace, like an important date in their love life happens. And this is why many people with generalized anxiety disorder may actually avoid situations, because they think that this is the only way to protect them from this very distressful, constant worrying and anxiety. So they do not take advantage of many opportunities in their lives. They may miss out in terms of living with their friends, with their family, of having all these experiences that are important in order to have a full and meaningful life. They may not have the career they would like to have because of all this constant and overwhelming and handicapping anxiety. In some cases, people have difficulty even doing the slightest daily activities, and they may get to a point where they can't actually get out of their house. So everything is causing anxiety to an extreme degree. When people suffer from severe anxiety, it is very often important that the specialist, that a special mental health care professional evaluates these people to see if the main type of anxiety disorder is generalized anxiety disorder, or if there's actually another type of anxiety disorder, like hypochondriasis, like obsessive compulsive disorder, like agoraphobia or other specific phobias. And now, the main question is, how can I deal with this important and constant anxiety? So there is a number of different types of treatment that can help with this disorder, and most cases can be cured, or the symptoms can be significantly improved in the vast majority of cases. As I said, psychotherapy is the number one type of therapy and treatment that is indicated for this type of cases. So, as I've said in a previous video, there are many different types of psychotherapy, like cognitive behavioral psychotherapy, or psychodynamic psychotherapy, or systemic psychotherapy. All types of psychotherapy, when conducted by licensed and experienced psychotherapists, can be equally effective when it comes to treating generalized anxiety disorder. Understand the nature of their symptoms, why these symptoms have appeared in their lives, what is their role in their lives, what exactly are they doing there, what is the nature of this anxiety, and learn how to cope with these anxious symptoms. As mentioned, in some cases it is important to consider the use of medication, of drugs like SSRIs or other antidepressants, especially antidepressants. There are also some treatments with Lyrica or some other medication that is used in order to alleviate chronic pain as well. So there is also a pharmacological approach to severe cases of generalized anxiety disorder which can be considered. Techniques like yoga, like meditation, Zen, and physical exercise can help a lot in order to control and to tame this uncontrollable in the beginning anxiety. So these alternative treatments may also be part or even the main focus of a treatment plan, especially if the problem is not of a severe intensity, as I mentioned before. However, it is very important to say that all relaxation techniques and types of yoga and physical exercise should be practiced regularly with a program, like on a daily basis, to dedicate a certain amount of time in a repetitive way so that a new habit, a constructive and productive habit, may be formed. Let's also mention that alcohol and caffeine are substances that can aggravate anxiety and even trigger panic attacks. So it is important for people who experience very high levels of anxiety to limit alcohol consumptions and caffeine to the maximum possible. And of course, participating in social activities like volunteering or doing group sports or doing artistic activities with other people seems, according to some studies, to help alleviate anxious symptomatology. So it is important to get involved socially, to do things in your community with other people. This particular treatment of anxiety disorder seems to suffer a lot because of the COVID pandemic, actually. It is finally important to mention that in order to feel better and to alleviate anxiety, what can help is to do your favorite hobbies and favorite activities in a repetitive and programmed way, deciding to specifically dedicate a certain amount of time at a specific hour every day, like an hour or 2 hours per day, into doing your favorite hobby, your favorite activity, like painting, like creating things with your hands, like getting a massage, or even playing a certain type of video game that you love. It is important to structure your everyday life in a way so as you can include in it as much of distracting and positive activities as possible. It is important to fill your life to the maximum with free activities or paid activities that make you feel happy, that make you feel good, that give you positive vibes. That could be reading a good book, watching a good movie, or even a silly video on YouTube, appreciating the sky. It could be like going for a walk with friends, playing with your pet, lighting candles and essential oils into your home, and putting on your favorite music. So it is important to cultivate the whole aspect of taking care of ourselves and of our well-being. This can also help people who struggle with chronic and intense anxiety symptoms. So that's it for today. Thank you for watching this video on generalized anxiety and how to deal with this problem. If you enjoyed the content, please like my video and subscribe to my channel, and I will come back very soon with more interesting videos on the topic of psychology, of motivation and inspiration in our everyday lives.